Nearly 44% of African American men and 48% of African American women have some form of cardiovascular disease. That includes heart disease and stroke. African American adults are much more likely to suffer from high blood pressure and heart attack and stroke deaths than white adults.
Your primary care physician or endocrinologist will lead your care team, helping you to make decisions on the treatment course to take.
So the role of the physician basically is to shepherd the patient in the right direction.
So if my doctor points me in the right direction, then what is my role on the healthcare team?
You're the boss. No one's going to do this for you but you. I mean, the doctor, the nurse, the pharmacist, we're all members of that team. The dietitian, we're all members of that team seeking to make sure that you do well. But the leader of that team should always be the patient. An empowered patient is more likely to succeed than someone who does not know what the whole visit ought to be about.
As team leader, how can I start taking care of my health?
The most important thing is to realize that if you're a member of the at-risk group, so to speak, that at least periodically you see your general internist or your primary care physician to get tested to see if this is something that's creeping up now. And then once the diagnosis is made, making sure that you understand everything there is to understand about the disease. What I keep on telling my patients is that knowledge is power. The more you know, the easier it is to deal with diabetes.
So I can regularly visit my doctor, and I can also learn more about diabetes, but I still feel overwhelmed.
All we are saying is that if you have diabetes, you need to get the right education, you need to be the team leader, and the rest is easy. You can do this. It's not that difficult once you make up your mind that you're going to be the leader of the team. You can do this.
Diabetes is the 5th deadliest disease in the U.S., and it's hitting Black communities especially hard. African Americans have a 50% chance of developing diabetes. Type 2 diabetes is both preventable and manageable. If current trends continue, Black men will be facing an epidemic of diabetes by the year 2050.
I work at a call center for Covered California, which is the California arm of the Affordable Care Act. I've received phone calls from African Americans all over the state, people from all over the state, but a lot of African Americans all over the state who have questions about what's available. They have jobs or they're self-employed. Self-employed people have been paying a lot of money for insurance. Now they can get help paying for it now through Covered California. But one of the main concerns of health in the Black community is this: high blood pressure, diabetes, sickle cell, and one of the main killers of Black men have been prostate cancer until just recently. My motivation for addressing African American health issues came from my own family. I suffer from BPH and high blood pressure and type 2 diabetes. My mother was a type 1 diabetic, and I had old cousins and relatives when I grew up who went blind because of diabetes. I had an uncle who lost limbs because of diabetes, and that was a terrible thing to watch a person go through that. So my motivation is to help educate and inform and just be a role model for stepping up on getting your health care taken care of and health needs addressed.
Overweight and obesity in children are significant public health problems in the United States. Data shows African American adolescents ages 12 to 19 were more likely to be overweight than non-Hispanic white adolescents. Let's Move is a comprehensive initiative launched by the First Lady, dedicated to solving the problem of obesity within a generation, so that children born today will grow up healthier and able to pursue their dreams.
stands for Racial and Ethnic Approaches to Community Health. There were two sectors, physical activity and nutrition, and both improving access to. Everyone should have access to healthy food. Everyone should have, access to safe places to play and be physically active. We chose to work with the African American community in San Joaquin County. It's been a community, being high for diabetes and high for cardiovascular disease and, all the chronic diseases you can think of.
This program is important from the perspective of getting the information out into the community and engaging people in the community.